Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why is there pain in my left arm and does it signal something serious? Pain in your left arm can have many different causes, from injuries and muscle strain to a pinched nerve or sprain. In some cases, left arm pain is one sign of a heart attack, myocardial infarction, which is a medical emergency. /r/n/r/n This article discusses some of the potential causes of left arm pain, including both cardiac and non-cardiac reasons. This information may help you decide when to seek help from a healthcare provider and if you need immediate medical attention. /r/n/r/nFly View Productions, Getty Images /r/n/r/n Depending on the underlying cause, pain in your left arm may be mild, moderate, or severe. It might radiate down your arm like an electric shock or cause a dull ache that is worsened by certain triggers, such as stress or physical activity. It could come on suddenly or appear gradually over time. /r/n/r/n Some of the most common causes of left arm pain include /r/n/r/n Below are common causes of left arm pain. /r/n/r/n Sudden, acute left arm pain may be caused by a broken bone. The most common causes of fractures are falls, accidents, such as car or motorcycle accidents, and sports-related injuries. /r/n/r/n In addition to pain, other symptoms of a fractured arm bone may include swelling, bruising, weakness, or difficulty moving. Sometimes, the bones in your arm may look disjointed or out of place. If you think you've experienced a fracture, such as if you hear a snapping sound when you hurt your arm, it's important to get help from a healthcare provider right away. /r/n/r/n Spinal discs act as cushions that separate the individual vertebrae from one another. Injuries and strains, as well as long-term degeneration and weakening, can lead to herniated or slip discs, meaning that part of the disc has been pushed out of place and pressed on the spinal nerves. /r/n/r/n If this happens in the cervical spine, the vertebrae in your neck, this can lead to peripheral neuropathy in the left or right arm. Peripheral neuropathy refers to pain, numbness, and tingling in the extremities. You may experience a pins and needles sensation, aching, or weakness in the affected arm, hand, and/or fingers, often alongside back pain. /r/n/r/n Cervical radiculopathy, known as a pinched nerve, can be caused by a herniated disc or other causes of degeneration, such as arthritis. Compression of the spinal nerves leads to pain, tingling, and weakness that radiates down the affected shoulder and arm. This may affect your left or right arm alone, or it can happen to both arms at the same time. /r/n/r/n There are four muscles that form a cover for the top of the humerus, bone of the upper arm. Together, they are known as the rotator cuff. /r/n/r/n When the left rotator cuff is torn, such as by an injury or degeneration due to aging or chronic overuse, it causes sharp pain in the shoulder that typically radiates down your left arm. It may get worse when you use it or if you sleep on your left side. /r/n/r/n Sprains and strains refer to injuries to the soft tissues that surround and protect your bones and joints. Strains are caused by overuse of or injuries to the muscles or tendons, while sprains affect the ligaments. They most often affect the wrists, arms, ankles, feet, legs, and/or fingers. /r/n/r/n Symptoms of a sprain or strain may include /r/n/r/n Tendinitis refers to swelling in the tendons, the tissues that connect the bones to muscles and help with movement. Typically caused by muscle overuse and repetitive movements, this condition involves tenderness and pain in and around the affected joints. /r/n/r/n Tendinitis is often caused by sports-related injuries, leading to common alternative names for the problem, such as swimmer's shoulder and tennis elbow. In addition to the joints, it can lead to pain that runs down one or both arms. /r/n/r/n vascular thoracic outlet syndrome, or thoracic outlet syndrome, is a condition caused by compression of the blood vessels and or nerves that pass from your shoulder to your collarbone, past your rib cage, and down to your arms. /r/n/r/n past shoulder injuries and anatomical differences, such as an especially long neck, may put you at a higher risk for this condition. It may cause left arm pain, or right arm pain, as well as neck and shoulder pain. Because of poor circulation, you may also notice weakness, swelling, coldness, numbness, tingling, and discoloration in the affected forearm, hand, and/or fingers. /r/n/r/n angina refers to chest pain and/or pressure due to restricted blood flow between the heart and the rest of the body. Typically caused by coronary artery disease, CAD, it may also be related to problems with the blood vessels. Some people with angina also experience pain in one or both arms, as well as their shoulders, jaw, neck, or back. /r/n/r/n angina is easy to confuse with symptoms of indigestion, such as heartburn or bloating. There are two types of angina: stable angina, which gets worse when you're exercising, and unstable angina, which happens even when you're not engaged in physical activity. Unstable angina requires immediate medical attention. /r/n/r/n bursae are the tiny sacs full of fluid that cushion and protect your joints. Bursitis refers to swelling and inflammation in these sacs. This causes pain, tenderness, discoloration, such as redness, and warmth in the affected joints. You may experience pain in your left arm if your shoulder is affected by bursitis. /r/n/r/n a heart attack is a medical emergency caused by a clogged artery or arteries, which cuts off the flow of blood and oxygen to the heart. The main symptom of a heart attack is chest pain, which may feel like mounting pressure or a tightening band. Many people experience this pain on the left side of their chest, which often radiates to other areas of the body, including the left arm. /r/n/r/n if you have any signs of a heart attack alongside left arm pain, you need to seek emergency medical attention. Call 911 or go to the emergency room right away if you experience /r/n/r/n you should also seek emergency medical care if you /r/n/r/n if you do not have any symptoms that might warrant immediate medical attention. You should reach out to a healthcare provider if your left arm pain hasn't gotten better in several weeks. You should seek help earlier if the pain is severe, if it affects your quality of life, such as your ability to participate in normal activities, or if you have other accompanying symptoms. /r/n/r/n in the meantime, you can take steps to soothe your pain at home. For example, try icing the affected area, applying heat, resting your arm, and/or taking over-the-counter, OTC, pain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, like Advil or Motrin, ibuprofen. Contact a healthcare provider if these measures do not help to resolve your symptoms. /r/n/r/n many people with left arm pain understandably worry that they're having a heart attack. If you have pain in your left arm that isn't accompanied by any other telltale symptoms, like pressure or pain in your chest, high blood pressure, or difficulty breathing, it's unlikely to be related to a heart attack. /r/n/r/n likewise, if you have no risk factors for heart disease, you have a relatively low chance of experiencing a heart attack, although it's still possible. Arm pain that gets worse with physical activity and goes away with rest is less likely to result from a heart problem. Still, if you think you may be having any cardiac event, it's best to seek help from a healthcare provider. /r/n/r/n if you go to the emergency room because you suspect you may be having a heart attack, your healthcare provider will most likely perform the following tests. /r/n/r/n meanwhile, left arm pain after an injury or for any other reason will typically be assessed with a physical examination and imaging tests, such as X-rays. Your healthcare provider will also ask you about your pain, other symptoms, medical history, and family history. /r/n/r/n treatment for pain in your left arm. Pain depends on its underlying cause. Examples include /r/n/r/n. Left arm pain can have both cardiac and non-cardiac causes. Some of the most common causes for pain in the left arm may include fractures, herniated discs, pinched nerves, rotator cuff tears, sprains and strains, tendinitis, thoracic outlet syndrome, and bursitis. Possible heart-related causes include angina and heart attack. /r/n/r/n. Call 911 or go to the hospital right away if you experience left arm pain and other signs of a heart attack, such as chest pain or shortness of breath. You should also get emergency medical care for acute left arm pain after an injury. /r/n/r/n. If the pain in your left arm persists for several weeks, reach out to a healthcare provider. The Y can provide comprehensive diagnostic testing and help you put together a treatment plan, which may include physical therapy and other measures to relieve your pain. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.